Our terms of reference are clear, and they require us to address some big issues, including how work outcomes for sole parents can be improved, how disabled people and those suffering from ill health who have some work capacity can be supported into work and independence, and how to learn and whether we can learn from the experience of the ACC and the insurance industry. Since we started just over a month ago now, we've been listening to a wide range of views. We've had a series of workshops around the country. Many of you here today participated in those workshops, whether they were in Kaitaia or the West Coast or the South Island. In visiting those areas, we've talked to a number of people with personal experience of the benefit system, as well as the providers and agencies who work in the social services sector. We've also talked with the businesses that work with some of the providers and employ many of the people that we will be talking about. This forum builds on these workshops and brings together a range of perspectives. We want to broaden the public debate and provide wider context for what is happening in New Zealand and internationally. By the end of the next 2 days, the Welfare Working Group wants to have identified the key issues that will enable us to drive in real change in the welfare sector. We need your help. But it's first important to have a discussion about why this is important. The New Zealand benefit system affects the lives of every New Zealander. In 2010, nearly 325,000 people, or roughly 1 in 8 working-age New Zealanders, receive a main benefit. Currently, expenditure on the benefit system, and excluding the tax credit system, accounts for 11.5% of core government expenditure. As many as 1 in 5 children are in families who rely on benefits. The large numbers of people currently on benefit reflects long-term underlying trends, rather than just the recent recession. In 2008, a decade of economic growth, and prior to the recession, New Zealand even then reached the point where roughly 1 in 10 working-age New Zealanders were receiving a benefit. To put these numbers in context, in the mid-1960s, about 30,000 people were receiving a benefit, comprising only 2% of the working-age population. We need to ask ourselves some fundamental questions about: are we truly less employable? Are we sicker? Do we suffer from greater degrees of disability? Two of the central questions the Welfare Working Group faces are: why does New Zealand have so many people on benefit, and why are some people on benefit for so long? We are not alone in looking at these issues. They are being debated around the world, and the good news is that we can learn from the evidence and experience of other countries. As we begin to define our way forward here in New Zealand, I want to start by acknowledging the reason we have a welfare system. At some point in our lives, many New Zealanders need some form of support because they experience a period of unemployment, or they get sick, or have a disability, or they lose a partner. Importantly, most people who need this support and use the benefit in these circumstances do so for only a short period. But when we look more closely at the statistics about people on benefit and discuss these issues openly in our communities, we see there's also a large number of people who are using the benefit system more or less permanently. For them, the safety net has become a trap. Of the nearly 325,000 people on benefit in March this year, roughly 30% have been on a benefit continuously for 4 or more years. Nearly 12% have been on a benefit continuously for over a decade. And even these grim statistics mask the true story around those receiving benefits for very long periods of time.